Afternoon. I wish to advise the witnesses that by virtue of Section 17(2)(l) of the Defamation Act 2009, witnesses are protected by absolute privilege in respect of their evidence to this committee. If you are directed by the committee to cease giving evidence in relation to a particular matter and you continue to do so, you are entitled thereafter only to a qualified privilege in respect of your evidence. You are directed that only evidence connected with the subject matter of these proceedings is to be given, and you are asked to respect the parliamentary practice to the effect that, where possible, you should not criticise or make charges against any persons or entity by name or in such a way as to make him, her or it identifiable. Mr Carroll, can we have your opening remarks, please? And could I ask that you confine them to 5 minutes, if possible, to allow as much time as possible for questions and answers. Thank you.
Thank you, Chairman, for inviting Meat Industry Ireland to the COVID Committee this afternoon. Meat Industry Ireland is the IBEC trade association representing the meat sector in Ireland, which accounted for almost $4 billion of food exports in 2019 into the UK, the EU and world markets. The meat sector contributes to the incomes of 100,000 farmers, employs some 16,000 people directly and comprises approximately 50 major processing sites all over Ireland. While there have been challenging days for our sector in the course of this COVID-19 pandemic, the position on COVID-19 cases in the meat processing sector has significantly improved. Today, there are no active cases in our meat plants, and our absolute focus is to maintain this position. Very substantial COVID measures have been put in place, and we can confirm that over 97% of affected staff have now returned to work, and the remainder are completing their isolation and recovery. The stringent control and mitigation measures in place will be maintained in the weeks and months ahead, with no room for complacency. Vigilance is the priority as general restrictions are lifted across the economy. Meat processing is a labour-intensive business with limited automation available due to the complexity and product craftsmanship of meat processing. The sector is one of the few sectors that remained open for business throughout the lockdown. The first confirmed case of COVID-19 was reported in Ireland on the 29th of February, and first stage restrictions were announced by government on the 12th of March. By then, and weeks before we entered full lockdown, MIA members had already introduced a series of mitigation measures which have since been updated to reflect evolving practice. It was not until the 15th of May 2020 that the HSE published its interim guidance on COVID-19, specifically for the meat sector, some 2 months after MII members first implemented detailed mitigation measures across all meat establishments. Where early cases were detected, businesses quickly responded by following the appropriate self-isolation advice for all employees who showed symptoms or who tested positive. MII members also traced close contacts who were also asked to self-isolate. The precautionary principle was followed, taking no risks with identifying positive cases in close contacts and excluding them from the workplace. A range of measures were identified and put in place with a singular and clear objective: to keep people safe. The state moved to a full lockdown on the 27th of March, at which time the government designated the meat sector amongst a range of essential services that would continue to operate during the lockdown. The first COVID-19 case was reported in a meat processing plant on the 17th of March. Further cases followed, and as clusters began to form in certain sites, the HSE provided collaborative oversight and assistance at local level. In all cases where clusters materialised, plant management engaged closely with the HSE and strictly followed their advice and direction. Contact tracing was recorded and transmitted to public health authorities in respect of all sites, and this has been publicly acknowledged by the HSE. It became clear that many of the cases that emerged were identified amongst people who had shown no symptoms of the virus and who continued to work. Many of these asymptomatic cases were detected as part of wider screening tests conducted at sites under direction of the HSE. This led to the emergence of a small number of clusters with significant positive cases, and ultimately to the establishment of a national outbreak control team. From the outset, a comprehensive set of mitigation and prevention measures was implemented at site level. COVID-19 response teams were established. Risk assessments were conducted by senior plant management Staff and union representatives were regularly briefed. Training was provided. Covid-19 signage and notices in all relevant languages were installed, as were additional and enhanced hygiene, sanitation and biosecurity protocols. Breaks and lunches were staggered to comply with physical distancing, including creating additional canteen and amenity capacity. Maintaining a 2-metre gap between people posed particular physical challenges for parts of the meat processing production chain, especially in deboning of meat, which is a labour-intensive activity. To address this, perspex dividers to separate side-by-side contact between employees were introduced, and visors were used for employees facing each other on the production line, as recommended by current HSE policy guidelines. Other steps taken included changes to rosters and shifts, line speeds were reduced, PPE was complemented by the introduction of masks, face visors or goggles, and there were changes made to workstation layouts. A key message to all staff was that they should not enter the workplace if they experience any of the known symptoms of COVID-19. As part of this, employees entering sites were required to complete questionnaires about COVID-19 symptoms and undergo temperature screening before entering sites. In addition, enhanced protocols were introduced in respect of all inbound and outbound animal supplies and product dispatch. These composite measures, numbering 60 or more, were implemented across plants some 2 months ahead of the interim guidance on COVID-19 provided by the HSE on the 15th of May, which reinforced the robustness of the measures already put in place in meat plants. Where additional measures were recommended by the HSE guidelines, these have been fully complied with. Verification of this has been overseen by both the Department of Agriculture, Food and the Marine, veterinary staff, who have a permanent presence in meat plants, and also by a series of inspections conducted by the Health and Safety Authority. The COVID-19 related challenges faced by the sector have led to concerns being raised about working and living conditions associated with the meat processing personnel. It is unknown why, in meat processing facilities in countries such as the US, Germany, the Netherlands and elsewhere, the infection rates are high in some facilities, while in other facilities the infection rates have been lower, even in multiple site companies that had common protocols across all sites.
Thank you.
The same issue arises in Ireland as to why there have been high-level clusters, low-level clusters and plants with no cases at all. There remain uncertainty as to how and why large clusters have occurred. This is recognised as being a complex, multifactorial problem with no clear and distinct conclusions. MII members are working with the authorities to examine all learnings from this episode so that a recurrence can be avoided.
Mr. Carroll, could I just ask that you conclude, please, as you make remarks?
Just on my last few paragraphs, Chairman, please. It is nonetheless true that there have been too many positive cases associated with meat plants, every single one being one too many. That applies to every affected sector, not just meat processing. It is equally true that meat processing has had to face challenges within plants at the same time as the virus was spreading at a rapid pace in the community.
Thanks, Mr. Carroll. I'm going to open the floor to...
finish my final few words, Chairman.
All right, no, Mr. Carroll, I've asked you to limit it, like every other speaker who's been here, to limit it to 5 minutes. So you've now taken 8. So I am going to open the floor to members so that we can have a questions and answers session. But I thank you very much. And also your opening statement has been circulated in advance. Thank you very much. I'd like to give the floor to the first member to ask questions, Deputy Devlin of Fianna Fáil, for 10 minutes. Thank you.
Thank you very much. Thank you, Chair, and thank you, Mr. Carroll and MII for attending today. I'm aware that the then Deputy, now Minister, Anne Rabbitte, was responsible for the invitation as a member of this committee for MII coming in today, so you're very welcome, and thank you for your opening remarks. Following on from the earlier session, if I could ask about the production levels of meat generally in the sector, both a normal amount of production and equally maybe during COVID and post, well, we're not really post-COVID, but certainly during the COVID, was there a rapid increase of production of meat? Are you aware of that, Mr. Carroll? Could I ask, please?
In the very early stages of the outbreak, and when economies started to shut down, a very significant proportion of the output which would be destined in normal circumstances to the food services sector began its decline, and that was essentially because restaurants and food service outlets right across the globe, and remember that we export right across the globe. The vast majority of what we produce, 90%, goes to EU and international markets. So a large proportion of that sector was completely shut down. That led to a period during which there was a substantially lower level of output. Subsequently then, as we saw the shutdown biting hard right across the world, what was essentially happening was there was a growth in the retail demand for meat products, and that stabilized the production base at a higher level.
Okay. My second question then, in relation to trace and contact register, is there one in place for the various companies or factories? Could you enlighten the committee on that, please?
Yeah, contract tracing was one of the early elements that was rapidly progressed within meat plants. You've got to remember here that in respect of every meat plant, the risk associated with having present on site people who had positively tested for coronavirus was a substantial risk to further spread of the virus within plants. So contact tracing was a fundamental part of the response by companies. And so for every single case that was identified as a positive case in a meat plant, those associated with the individual who had tested positive were tracked and traced by members of staff in meat plants, and all of that information was comprehensively communicated to the HSE. And it is interesting to note that when some issues arose over that about 5 or 6 weeks ago, the HSE were very quick to point out that the level of contact tracing provided by factories was almost at 100%.
Okay. And then following on from that then, are you saying that each factory or each producer would have a COVID officer? And if so, if that's the case, in terms of guidelines being issued to them, and then subsequently the operator or the owner of that factory or facility, those guidelines, are they being communicated to the staff? And as we heard from the earlier session, Chairman, there's obviously language barriers with some staff. Have they been translated into other languages so all the staff are very aware of the various protocols and practices required within those factories?
Yeah, well, can I just say, I suppose, that right from the outset, a COVID compliance officer was appointed in every plant, and that officer was at senior plant management level. And I suppose the first steps that were taken were an assessment of risks having been carried out at each point. And for each point of risk, an enhanced measure of protection was implemented, tested for efficacy, and further reinforced where deemed necessary. There was substantial engagement around all of those measures with all plant staff. I mean, the circumstances here was that the risk was so great at plant level that every single element of every measure that was implemented in each of the plants needed to be communicated to every individual person working in those plants across the different types of activity that were being conducted in the plants. This was the best way of mitigating risks, and it was also the best way of ensuring that there could be a lesser spread than potentially could occur were nothing to have taken place. And so the initial work done in association with MII and the companies concerned was to identify every single one of those risk points to find a mitigation for them, to design the protocols around those, and to ensure that those protocols were implemented right across every single site. And I think the proof of the effectiveness of that has been in the response that we've seen from HSA inspections of plants, which have, generally speaking, found that the measures taken were more than adequate for the purposes that were intended.
And could I ask, were those protocols communicated to all the agents or the companies? And second of all, following on from that point, those inspections, the HSA inspections, were they notified in advance? Were the companies notified in advance of those inspections?
Well, to your first question, yes. All of the protocols were developed in conjunction with the companies. You've got to remember that there are different site circumstances in every single situation, but the comprehensive set of guidelines covered all of the variances right across the board. And secondly, my understanding is that the HSE site inspections are undertaken on the basis of advance notice. Now, part of the reason for it, and that, by the way, was the decision of the HSA, that was in no circumstances influenced by any pressure that we may have put on them, which we did not. It was a very clear situation. The HSE, in attempting to, HSA rather, in attempting, I think, to comply overall with the protocols, didn't want and didn't feel it appropriate to arrive at a site where there was a potential for COVID spread. And so in essence, they decided that it was better to notify plants that they were coming rather than appear on the doorstep. Now, I could also perhaps add to that there is a permanent presence of department veterinary inspectors in all meat plants. They're there all year round, every day. As somebody once said, if there's a light on in a meat plant, there's a veterinary inspector present from the Department of Agriculture. But as far as we are concerned, it is entirely a matter for the HSA whether they come with an unannounced inspection or an announced inspection. It's entirely irrelevant to the meat plant operation in which circumstances they decide to arrive for an inspection.
Okay, well, from my own viewpoint, I suppose I think the unannounced probably are better, but I acknowledge in your statement the level of compliance that you state there is. And then finally, Chairman, could I ask, did MII view and approve all the protocols with regard to those COVID policies that you spoke of that had gone out to contractors, and were MII members available to public health teams for scrutiny?
I'm sorry, would you mind just repeating the last piece?
Yeah, so were the MII companies that we're speaking of here today, were they available to public health teams for scrutiny? So the operators themselves?
In all cases, in the early stages, there was a degree of contact between HSE at local level, not at national level, as distinct from the wider HSE protocols that I referenced in my opening statement, which were published on the 15th of May. There was a degree of consultation at local level between the HSE and all of the plant management. And at no point at any stage was there any divergence of views as to the efficacy at that stage of the protocols and the implementation of those protocols at plant level.
And then finally, and thank you for those answers, finally then, just in terms of a potential second wave for COVID, in your opinion, how do you think that the meat plants are capable of responding to that? Do you think that the current guidelines are sufficient, and will they remain in place?
The guidelines have developed to some degree in respect of the 15th of May guidelines that were published by the HSE. Now, essentially, all of the things that were happening at meat plant level prior to the 15th of May were encapsulated in those HSE guidelines, and there were some additional points in that. We have just received in the last few days an updated set of guidelines without any significant additional actions required on the part of meat plants. I wouldn't want to presume that everything is perfect. I think things have reached the point of perfection, that we have reached the stage where we have no active cases, having had a significant peak in cases in around late April and the early week, probably the last 2 weeks in April and the first week of May. That was a significant spike in cases in meat plants. That spike corresponded pretty much with the spike in cases that occurred in that period in the general community. So look, I'm not going to be confident enough to say that everything is perfectly correct, but what we will do constantly, every single day, is remain vigilant. We will adhere to all of the advice that we get from the HSE and the HSA, and indeed from the Department of Agriculture, and completely comply with all of those requirements.
Thank you, Mr. Carroll, and thank you, Deputy Matt Carthy.
Garmaiga Cahirlock, and thank you. Can we get to? Yep.
Go ahead. Is there a?
Just the wrong mic. Yeah. Sinne Garmaiga Cahirlock, and thank you to our guests for being here. Can I just ask? And I've a number of questions, and they're all very short and require short responses. How many cases have there been across meat plants in the state?
Today, our count is, and I can only account, Deputy, in respect of the plants that MII represent, which is most of the plants.
That's fine.
But not all of them. So there are approximately 1,100 positive cases since the commencement of the COVID outbreak.
For that. So you mentioned that there are now no active cases, which we all hope is the case. So the reduction of those cases and the reduction of instances at meat plants, is that down to what's happening across broader society, or is it down to the actions that have been implemented by your members?
It's very difficult to assess this, Deputy, and you know we're aware, and I mentioned it in my statement, that we've seen active outbreaks and clusters in other plants, in other parts, in other jurisdictions. So it's very difficult to sort of pinpoint a single reason why we have managed to reduce the number of cases. As I said earlier, there was this connection when the spike hit with what was happening more widely in the community. That said, the measures, I suppose, over a period of time have proven to be pretty robust. One point I would make to you in answering the question is that when there had been some disagreement or uncertainty about the relevance of asymptomatic cases, we did find that having had a spike in cases as a result of mass testing, screening testing that was done at particular sites, there was the discovery of a substantial number of those positive cases came from people who were completely asymptomatic.
So let me ask you this, how often and how regularly is mass testing taking place now in your?
As far as I'm aware, I think we've had mass testing in maybe five sites overall, and these would have been 5 sites where there were significant clusters. In other words, before the mass test.
The process of mass testing ongoing across all of your members' plants as we speak.
I'm sorry, could you ask me that again?
Is the process of mass testing, in other words, is there periodic mass testing taking place in your member sites as we speak?
No.
Maybe that would be an idea. We had a discussion earlier on, and there seems to be a little bit of confusion. Can you indicate what proportion of the staff and workers at your members' meat plants are migrants?
Can I ask Joe Ryan to answer that question?
Yeah, thank you, Chairman. Well, firstly, I don't know the definition or your definition, Deputy, of migrants, but in terms of the nationality of our workforce, based on our own analysis of it, 30% of our 15,000 people in the industry are of Irish nationality. Another 50% are from EU excluding Ireland, so therefore 80% of our workforce are EU citizens, with the balance then being people who were who came into Ireland legitimately on employment permits over the last...
30% are Irish?
Right.
Okay, well I think we could take it then that 70% are migrant, and if I was working in Poland I wouldn't consider myself to be a domestic.
Would you consider yourself to be an EU citizen though? Like Deputy, you know, the claim has been made that the industry is based solely on migrant labour, but EU citizens who are here, and we heard from some previous speakers this morning who are here 10 or 15 years with children in college and have developed their own you know, have come to live in the country and here that long, are they still classed as migrants? We don't believe so.
Okay, well, 30%.
Finish my point. If I might just finish the point.
Of your workforce are Irish nationals. What proportion of management across your sites are Irish nationals?
I don't have an exact figure on that, Deputy, but what I will say is we have a wide range of roles across the sector, and production roles, be it from operatives to knifemen to supervisors to health and safety people to food production and technical roles, to other roles such as logistics, finance, engineering, IT. And so while people come in, and one thing we do see, and we did some analysis on this in recent years in the context of employment permits, one thing we do see is that the majority of supervisors and management in sites have come from production roles and developed and progressed their career up through the... Why
do you think it's so high, the number of people from outside of Ireland that are employed in your sector?
Sorry, Deputy, I didn't catch it.
Why do you think that the figure is so high? And it's not to say that they're not welcome. I'm sure they're all valuable members of your workforce, but it is a proportionally incredibly high figure of people from outside of this country that are working in your sector. Why do you believe that is the case? Well,
Deputy, you are right. They are incredibly important and valued to us in the workforce. And I don't know that we are unique across, when you look across the various multinational companies in terms of the breakdown of our nationality. I wouldn't say that we are that unique, but they are, as I said, very valued. Why do we have that breakdown? I don't know, Deputy. We are a sector that, like other sectors in the economy, in recent years, as the economy moved to full employment, have had to seek additional workers from outside of Ireland. And thankfully, through free movement in the EU, a lot of our workers come from other EU members.
Have anything to do with the wage levels that are being paid by your members?
I don't think so, Deputy. I think in reality, when you look at full employment in an economy, you are going to be dependent on people coming in from outside of the country.
But do you not believe that wage levels have anything to do with that?
I don't, Deputy. When you are at full employment, you are naturally going to have to look outside of your country for additional workers.
Well, I'll just make this as a comment. There are sectors that don't have the same proportion. Cahirlock, and in most instances those sectors pay higher wages. SIP2 have indicated that if there is a second wave, then it will emerge from a meat plant. Do our guests agree with that?
If I could come in, Deputy. Well, I think the question was raised earlier around the threats of a second wave. I think what we do have now is extremely comprehensive and robust measures in place. I think that's the priority, that they are maintained, and I think we've said consistently too, this isn't a case of getting to this point, thankfully, where we don't have active cases. It's a case of maintaining, no room for complacency. So I wouldn't agree with the view expressed about SIP2 that it's likely to come from a meat plant. We have to remain vigilant, Deputy.
Apologies for interrupting you, Mr. Healy. Can I ask how many times Meat Industry Ireland has met with SIP2 or other trade unions to discuss workers' concerns regarding the practices or otherwise within meat plants?
Deputy, we haven't. We have been in correspondence with SIPTA, but Meat Industry Ireland overall throughout the years, in terms of our role as a representative organisation, policy and technical issues, we haven't been involved in that area of the business in terms of labour, in terms of employment, in terms of employment conditions, etc.
In the context, apologies again, in the context of a global pandemic that was having a very real and considerable and disproportionate impact on your sector, did SIPTU not seek a meeting with you? Or what rationale could there possibly be for you not to meet with representatives of workers who are raising public concerns with regard to the practices in your sector?
None, and we had communication from SIPTU, Deputy, and we did indicate and respond to that, indicated that primarily actual labour and employment is dealt with by individual members, but remained open to discuss it. The priority though, Deputy, was the engagement at local level on the one hand, and there was engagement with each individual company and their staff and union representatives where that was the case and appropriate. But also then the priority was in engagement with the authorities at local level, the HSE, at national level once the National Outbreak Control Team was formed.
Oh, can I take it then, and I just want to make two points. The first is, can I take it from Mr Healy's response that they are open to meeting with SIPTU and other trade union representatives, and if they are, I would encourage them to do that as a matter of priority. And secondly, just to revert to the point of the HSA inspections, that is a phenomenal revelation here today, that there hasn't been a single unannounced inspection by the HSA. We know they were late in terms of carrying out those inspections. I note in the Agriland in the last short while there has been a story that says the HSA is to begin a farm inspection blitz from Monday. I think it just sets out the double standards that are applying in relation to all of these matters. The HSA were incredibly slow to carry out inspections with regard to meat factories, and in turn haven't actually carried out any unannounced inspections to date. I would ask our speakers and this committee to liaise with the HSA to get clarification as to why that is the case, because I don't believe that's acceptable.
Thanks. Unless Mr Healy wants to come in on the unannounced inspections, I'll move on to the next speaker.
Thank you, Chairman. Just briefly, I mean, the HSA, as Chairman outlined earlier, that was a decision from the HSA in relation to announcement of inspections or not. We don't have any issue with announced or unannounced, as the Chairman said. But also, I think it's important to note that there is also, and throughout this, we've been working closely with Department of Agriculture at local and national level. There is a permanent presence, and the Department of Agriculture, as inspectors across a wide range of government departments, have engaged with HSA.
Very much. Thank you, Mr Healy, and thank you, Deputy Carthy. I suppose I would, just as a quick follow-up, point out that we've taken a submission from the Department of Agriculture, and they have said that the department's responsibility, slaughterhouses and processing plants, is primarily to ensure that such establishments operate in compliance with food hygiene legislation and focus on ante and post-mortem inspection services, sampling for BSE. So basically, it would appear to me from what the department have said that, consumers rely on the Department of Agriculture inspection, and the Department of Agriculture inspectors are hugely important for consumer protection, far less so from the point of view of workplace safety and workers' protection. But look, I'll move on to the next speaker, who is from Fine Gael. Deputy Burke, you're taking 10 minutes?
10 minutes, yes, yeah. Chair. Thank you very much, Chairperson, and thank you for your presentation here today in relation to the meat sector and the industry. Can I just say, and you may have said this already, but I just didn't pick it up. Of the total, I understand that there are around 50 meat processing plants across the country. Of that 50, how many were identified, or how many of those units were employees identified with COVID?
I can take that. I mean, I think, Deputy, I think, I mean, HSE has indicated that in terms of clusters, which is 2 or more cases, in terms of their definition, I think it's 22 or 23. I'm just checking with my colleague, but 22 or 23.
And can I just ask you, and then you have quite a number of plants where the COVID wasn't identified. What did they do differently compared to the 22 where it was identified? What measures did they do differently at a very early stage? Because obviously, if it didn't come in there, they obviously had safety measures in place at an earlier stage.
Yeah, I think, and I'd further precise even in terms of your question, there was even fewer plants than that had significant numbers. That's well, one, I think all our plants had measures in place. From early to mid-March, there was a ramping up and a development of the protocol that the chairman mentioned, and those were being put in place across sites. It isn't clear, Deputy, exactly why the reality, and it's been experienced internationally too, that in some sites or facilities there have been high numbers, in others low or no numbers. I mean, that's not fully clear.
But would it not be wise for the industry now to look at this issue and see what was done differently in the plants that did not have any cases compared to the plants that had the cases? And this is about looking in case, and I hope it won't happen, that we have a second surge. You know, what is now, isn't it now the time to look at this issue?
I think you're right. I mean, firstly, in terms of the verification process that's been touched on here, I mean, there has been ongoing verification both from Department of Ag and the HSA around the measures. Are the measures in place? But you are right. I mean, and there is work going on in conjunction with the Department of Agriculture, which sits on the National Outbreak Control Team, to look at some of these issues, to retrospectively look at some of the factors and get a greater understanding as to why. Because if there's anything that can help in terms of any kind of a second surge, particularly if, as the economy opens up and restrictions are lifted, and if there are, many commentators have talked and expressed fears about second surges in countries, that work is being done with the Department of Agriculture. And
can I just move on to the issue where information was conveyed by the HSE to facilities, to the employers, about employees who had identified positive before the employees themselves were advised? Why was there pressure put on by the industry for this to happen?
Sorry, Deputy, would you mind just repeating the last sentence there?
My understanding was that there was pressure put on the employers for the information to be conveyed to the employers before it was conveyed to the employees.
No, that is not the case. There was no pressure put on by employers for the information to be conveyed to them before it went to the staff.
When it did become available to the employers, would it not have been the appropriate matter for the employers to say, in following through on people's rights, etc., that basically should you not be advising the employees before you advise us?
But if the rights of individuals were undermined, it wasn't by pressure applied by meat processors. The circumstances of this, I think, were discussed perhaps at one of your committees at some stage when it was suggested that there was an issue, I think, around GDPR and the rights of individuals to have the information around their own health first, and we completely concur with that. Don't see any issue at all with that. Would not dispute it in any shape or form.
One must have made the arrangement,
so what
HSE, for the information to be conveyed to the employers first.
So what actually happened was the information, in certain instances, I understand, because people may not have been contactable who actually had positive cases but were working in plants, the decisions were taken in the context of ensuring that if individuals had tested positive and were working in an occupational environment, the risk of spread was greater if those individuals were not excluded from that workforce.
Okay. But are you're confirming so that there wasn't pressure put on
Absolutely not.
the HSE at any stage?
Never.
But you do accept that once the employers got the information, they should have conveyed back to the HSE, well, really you should be advising the employees first.
But the understanding was that they were either being advised at the same time, but particularly that the employee would have been advised initially, because it was a case of the employee's health rather than...
Can I just move on to the issue in relation to permits and people coming in from abroad? My understanding is that it's the employer who arranges and works with the person who's coming in with the permit. It was suggested here this morning that there should be sectoral permits rather than that the person is tied to the particular employer who is involved in getting the permit. Can I just ask you, would you be happy, or would the industry be happy with that, the current system being reviewed? Because it was outlined to us this morning that workers find that they have less rights because their employer, if they're no longer employed in a particular company, they really have no rights here then.
I'm happy to take that one, Deputy. Look, I suppose our interaction with our knowledge of the employment permits legislation is insofar as how much we interact with it over recent years. We have engaged with the employment permit legislation and the Department of Business in terms of seeking a quota of permits, because for reasons of trying to recruit workers. But what I'd say is, I suppose, if there are to be changes to the employment permit legislation, that's probably for a different forum to discuss. And there are obviously many other sectors that interact with the employment permit system that would also probably wish to feed into that as well.
What I'm asking is, would the meat sector have an objection to the changes to be made, that the person gets a sectoral permit as opposed to a permit tied to one employer?
Well, my understanding of the permit legislation at present means that workers, after they come in, after their first year on an employment permit, are eligible to move to other employers within the sector already.
But you do accept that some people who find they're tied to a particular employer find that they are slow to raise issues of concern to them, whether it's about health or safety, whether it's about any other issue, because they're worried about if they want to transfer on afterwards, that it could cause concern for them.
Deputy, I suppose to answer your question, if there are changes to the employment permit legislation that cover the situation that you're speaking of course we'll deal with those with the new legislation in that case.
Yeah. In the presentation today, and I just want to talk about the asymptomatic and people identified, is it possible that people felt that they don't have the same level of supports there? And I talk about the people who are in from abroad, that you identified a lot of people asymptomatic. Is it and because people don't have a huge amount of supports if they go out on sick leave, is it possible that people